Welcome to Raaonline. Today I am going to discuss you on topic drugs for constipation. Basically this topic will be divided into two portions. One is what are the drugs that are used for the treatment of constipation, and next one is the treatment for diarrhea, that is anti-diarrheal drugs, including the drugs for inflammatory bowel disease. So here the competency is we are going to discuss about the mechanism of action, uses and adverse effects of laxatives, that is the drugs used for treating constipation, and the antidiarrheals, the second part. Okay, so we are going to see the classification of laxatives. Okay, and we are going to discuss about briefly the osmotic purgatives. There are different types of laxatives actually, like laxatives, osmotic purgatives, and stool softeners, like that. And so second part in treatment of diarrhea, we are going to discuss about the ORS therapy, the pathophysiology of diarrhea, and the role of probiotics in diarrhea, which is very important. And also we are going to discuss about the anti-secretory and anti-motility drugs, including the role of zinc supplementation in diarrhea. And finally we will be ending the session. The second part of the talk will be with mechanism of action, uses and adverse effect of mesalazine, that is the drugs used for the treatment of inflammatory bowel disease. So outline, first talk we are going to see the brief introduction about laxatives, purgatives, and then the second talk we are going to see all the other contents. So first we will move on to the introduction. So we are going to see some of the definitions, like, so what is constipation? The constipation means there is a delayed passage of feces. Okay. But what is about dyschezia is the dearrangement of defecation process. So whenever there is a delayed passage of fecus, like say for example the bowel movements, the peristaltic movement is decreased due to some reason, okay, there will be a delayed passage of the fecus. So that can lead to accumulation of the stools, and then they can go in for constipation. Dyschezia means the derangement of defecation process. Defecation process involves the stimulus has to go to the brain, okay, and due to the fullness of the colon with the fecal matter, then the stimulus goes to the brain, and the process, the motor sensory component goes, and the motor component comes, and then finally it has to play a role in the process of defecation. So if there is any derangement, then it is called the dyschezia. There are constipation you can classify as two types, like one is organic constipation, which is due to the secondary cause, like due to some other disease like hypothyroidism, okay, or some other drugs, when the patient is on some drugs like opioids, okay. Whereas functional constipation, they mainly due to that can be corrected by increased fiber content. So we can ask them to take increased fiber content, then increased fluid intake and increased physical activity, and they are not neglecting nature's call. Like for example, the people who are just going early in the morning and everything, they will forget about this. Normally at what time? Morning 6 or 7. Normally we will open the bowels, right? So that time if you are going for some other work and that doing, so when we neglect the nature's call, so that can also lead to the functional constipation. Similarly, when the patient is having, people are having a sedentary life, okay, decreased physical activity, so they will also have the functional constipation. So if you correct all these things, the fluid intake and the fiber content and increased physical activity, then we can correct the functional constipation. So coming to the terms laxatives. Laxatives means it is a milder action, and just it eliminate the soft but formed stools. So normally we prescribe in patients with constipation, we prescribe the laxatives only because it has got a mild effect. Okay, just it eliminate the stools, the formed stools. Okay, what about purgatives? Purgatives is a little bit of stronger action. Okay. And so what happens, it will have a severe contraction of the bowel, that is peristaltic movement, and more of the water, salt secretion will be there, so more fluid will also be evacuated. So there will not be any formed stools, it will be like almost like a watery type of thing, okay, but it is a little bit stronger effect actually, purgatives means. So these are the two main terms, laxatives and purgatives. So the most commonly prescribed is laxatives for constipation, but in some cases they might need to give purgatives, like for example if the patient is going in for colonoscopy, or they want to prepare the bowel before the bowel surgery, colon surgery. So in such cases they will be using these purgatives to completely evacuate the bowel. And many of these agents acts as laxatives in smaller doses. So if you give in small dose, they will act as laxatives, But if you are giving in higher dose, then they'll behave as a purgatives. So the order of grading of drugs, how can you grade the drugs? Like say if you call it as aperient, that means to get rid of. Whereas laxative means, lax means just relax, so to loosen. Okay, so both are almost similar only. Aperient and laxatives are almost similar, where you just get rid of or loosen the fecal matter so that it can easily get rid of. Emollient means to smooth and soften. Okay, evacuant just to empty it. Okay, whereas the purgative is a little bit more stronger action, as I told you earlier. It will just clean away the bowels. And cathartic is still more stronger to utterly clean, completely it will clean the bowel mucosa and everything, bowel. So these are the terms depending upon the severity or depending upon the effect. Okay, so this aperient and laxative is a mild type of effect, maybe emollient, evacuant, intermediate, and this purgative and cathartic are a little bit stronger in action. Right, now coming to the classification of these laxatives or purgatives. So the first category is the bulk forming. The name itself suggests bulk forming. So when you prescribe these kind of drugs, medications, it's basically like a powder type of things, which is a dietary fiber, and they absorb the water and then they get swells up. So once swells up, it will increase the fecal mass, and once the fecal mass that increases, it will send the stimulus to the brain, and then so that they can go in for defecation process. Okay, so that is the bulk forming laxatives, where the dietary fibers like bran and psyllium, that is ispagula husk, methyl cellulose, these are the things which can be used. Stool softeners, the name itself suggests they will soften the stools, like docusades and dioctyl sodium sulfosuccinate, and liquid paraffin can be used. And stimulant purgatives, we have got a different subcategories. The first one is diphenyl methanes, where the examples is bisacodyl, which is commonly can be prescribed, and sodium picosulfate. Next comes the anthraquinone variety like Senna cascara, they are obtained from the plants. Then 5-HT4, the serotonergic agonist, acts on the subtype 4, which is prucalopride, and the prostaglandin analogs like lubiprostone, which is a newer one, little bit expensive, and also the castor oil can be used. So these are the 5 categories which comes under the stimulant purgatives. Finally, the fourth one is the osmotic purgatives, like they are mainly the magnesium salts of sulfate, hydroxide, and the sodium salts similarly, and sodium potassium tartrate, whereas lactulose and lactitol. Lactitol is the same, almost similar to the lactulose. So these are the osmotic purgatives. This osmotic purgatives, the name itself suggests by osmosis. That means the more water will be taken from the interstitium to the lumen. So because of the lumen will be filled with more fluid, and the constipation will be relieved actually. Okay. So these are the 4 categories of the laxatives or purgatives.